Hi, I'm Lois. I'm the founder of Restored Eden Physiotherapy. I want to talk to you today about chronic pain. So I had a client today who came in with low back pain on his left side. He's 56 years old and he's been having ongoing back pain on and off since he was 16. And he's also got knee pain in both knees, but particularly his left knee. So after talking to him about his history, he basically did something when he was 16, bending over, and he felt his back pop when he was lifting something, and then he went to the army. It kind of got better. He did another thing in the army which made his back hurt. Then that got better, and then he kind of went through his life taking up various different exercises, like he had a go at judo and jiu-jitsu. Somebody threw him onto the floor and that hurt his back again. He had a long time off exercise. Then he took up kickboxing and then he got really into that, and that was fine. But like basically he's got to 56 and he in his head is saying that he's had low back pain for all of this time, but on assessment he actually doesn't have any leg pain, he doesn't have any serious symptoms, and after just like 60 minutes massaging and mobilizing his back, he actually had full range of movement. So what he thinks as chronic low back pain actually was tight muscles and stiffness in his spine, which was relieved quite quickly because he has a physical manual job. He also is very weak in his legs. He said that 5 years ago a big truck ran over his foot and his entire left foot and ankle got squashed, which sounds horrendous. So he's got a lot of metal work in his left foot, and as a result of that he got very depressed and drank a lot, and split up with his wife because he was drinking so much because he was depressed from this injury to his foot. So it sounds like a very in-depth story of how he's come to where he is now. So on examination it turns out that his left leg is a lot weaker than his right leg, and his right leg is quite weak because as a result of his foot being driven over, he wasn't able to do any exercise at all really. He just had to sit there for months on end while it was healing. So both legs got weak, and it doesn't sound like he had proper rehab afterwards. So then although he has a manual job, he hasn't fully got his strength back, even in his glutes. He's got nothing wrong with his glutes, he's got full range of movement in his hips, but his muscles are tight and weak, and his quads are weak, so he's unable to stand on one leg easily, and doing single leg squats is very unstable. So basically on examination he's lost a lot of strength, which is causing him to have knee pain because he's unstable, and that's also affecting his back. But really, when he had a full examination of why he's got the pain that he's got, and the fact that the way to solve this problem is to do these particular exercises and to do exercise every day so that he can get his strength back and mobility and just energy levels back, that's then enabled him to look at his life and see like, oh right, okay, so actually I'm not falling apart, I'm actually in quite good health, but what I need to do is do these exercises and do that. And that made him feel a lot better about himself. He felt like he was having a proper full-on examination, which then gave him and empowered him to do what he needs to do to get back to what he needs to do. And also he said he struggles with smoking and drinking, but that's a result of feeling quite depressed about feeling like he's let himself down. Like he said that when he was doing kickboxing he was feeling really fit, and it was the fittest he's ever been in his life. But then because he went out drinking and smoking one night, and then he got back into smoking, and then as a result of that he gave up kickboxing because he felt like he'd let himself down. But I was like, well, obviously smoking isn't good for you, but smoking and kickboxing are two different things. just because you start smoking again doesn't mean you have to stop kickboxing, because if you continue to do the kickboxing or continue to do the exercise that's making you happy and fulfilled, then you're probably going to want to give up smoking at some point in the future anyway, because you're going to feel like you're getting empowered and you're getting fit and you've got some purpose in your life, and so then you don't really want to carry on smoking. So I think the point of this video is that just taking a step back and thinking, what would a bird that's looking at my life think about what is going on? So why do I have the pain that I've got? Why do I do the exercise or not do the exercise that I know that I should be doing? What exercise do I need to do to fix my problems? And if I am getting depressed, or if I'm getting anxious, or any kind of thoughts which aren't healthy, then why am I thinking those, and what can I do about it? And when you look at it with a bird's eye view, it's much easier to make sense of what's going on and to think, right, okay, so I just need to be nice and steady and put thought into what I'm doing and why I'm doing it, and move forward from there. So if you need any help with any of that, like if you don't know why you're experiencing the pain that you're experiencing, if you've got chronic pain, is it because you're getting older? I very much doubt it. There's not really anybody that I've ever met that I've said, yeah, the reason you're in pain is because you're this age, and when you get to this particular age then everything falls down and goes downhill. No, it doesn't work like that. If you're experiencing pain, then there's a reason. You can say, okay, well, you're experiencing this pain because this is weak, or this bone has got degeneration, or that has got a problem, or this has got a problem, and these are the solutions to do something about it. And there's always a solution, and we can always get fitter than what we already are. And so if you do need some help with that, then please do book an appointment, either online or face to face, with myself or somebody else in my team, and we will be more than happy to help you. Please have a lovely day, and I will look forward to receiving your comments below. Thank you so much. Bye bye.